Physical assessment critical 9/29/17. No. Hi, I'm Joya. I'll be a student nurse today. We're going to do a physical assessment. Could you give me your name and date of birth? Patient states his name and date of birth. Can you tell me where we are and what year it is? He states we are at East Central Community College and it's 2017. The patient is alert and oriented ×3. I would then ask the patient to walk to the bathroom to change to a gown. Upon walking, I notice his gait. It is not, there's no limping. His gait is steady. Okay, we are now back in the bed. I perform hand hygiene, patient privacy, making sure I have the appropriate lighting. Looking over the patient, he shows no signs of distress. His hair is well grown. His mood and affect are good. He's smiling and talking. I'm going to ask if he's in any pain from 0 to 10. On a scale from 0 to 10, he says 0. The patient is in no pain. His hygiene is good. He's dressed appropriate for the weather. Looking over his skin, feeling it's warm, dry, pink in color. No abrasions, lesions or wounds. No edema present. Checking capillary refill less than 3. Capillary refill less than 3. I am going to assess his turgor. Turgor is brisk. Turgor is brisk here also. Assessing the range of motion. I would ask if there's any pain with range of motion. Patient states there's no pain with range of motion. No pain with range of motion. Okay, I'm now going to listen to his lung sounds. I'm going to start with the right upper lung, left upper lung, left lower lung, right lower lung, and the right middle lung. All lung sounds are clear on the anterior bilaterally. I'm going to listen to the posterior lung sounds. Starting with the left upper posterior lung, the right upper posterior lung, the right middle posterior lung, the left middle posterior lung, and the left lower posterior lung, and the right lower posterior lung. All lung sounds are clear on the posterior bilaterally. No redness, lesions, or wounds to the back. Now I'm going to oscillate his heart sounds. Starting with the aortic on the second intercostal space to the right of the sternum, the second intercostal space to the left of the sternum, which is the pulmonic, the fourth intercostal space with the tricuspid, and the fifth intercostal space on the midclavicular line is the mitral area, where I would also listen for the apical pulse. The rate and rhythm is regular and steady. I'm now going to assess his abdomen, inspect the abdomen for any bulges, distension, masses, or pulsation. There's no bulging, masses, distension, or pulsation. I'm going to osculate, starting with the right lower quadrant, left upper quadrant, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are present in all 4 quadrants. Now, if not, I will listen for a full 2 to 5 minutes. Now I'm going to palpate, asking the patient to let me know if there's any pain with palpation. It is no pain with palpation, non-tender, non-distended, and soft. Checking his carotid pulse on the right, palpating it. Palpating the carotid pulse on the left. Palpate the brachial pulse on the right. Brachial pulse on the left, both are strong. Radial pulse on the left. Radial pulse on the right, both are strong. Okay, now I'm going to work on his lower extremities. Taking note if there's any wounds or no abrasions, bruising, redness, no edema noted in either extremity. Checking his popliteal pulse on the right, popliteal pulse on the left, both are strong. Posterior tibial pulse on the right, posterior pulse on the left, both are strong. Dorsalis pedis on the right, both are strong. Dorsalis pedis on the left, strong. Checking capillary refill, less than 3 on both sides. Okay, I'm going to have you push against my hands, testing his lower strength. He has equal strength bilaterally on both lower extremities. Assessing his range of motion. I want to see if there's any pain with range of motion. Patient states there's no pain with range of motion. I'm going to check his upper strength. Patient squeezes my hands. Strength is equally strong bilaterally at the upper extremities. Now I'm going to check his pupillary reaction to light. Seeing if he follows commands, I will have him follow the light. Patient is able to follow commands. Now I'll have him look at my nose, dim the lights. Pupils are equal round, react to light with accommodation. And checking sensory function, I have a sharp edge, sharp, dull, sharp, dull. Patient wiggles his toes, no numbness or tingling. I'll position the patient comfortably back in bed, lower the bed to the lowest position, and give him the call light. Thank you. This concludes my physical